So Binu, Dinny, Evelyn, Reena, Rehana, Shimra, bring at least one candidate for yourself. Okay. I'm going to try to do something different today. What others don't see, that I am going to show you something different. So why don't you share this link with your friends so that they also can enjoy. So share the link with your friends so that they also can enjoy. So I have given you the link. So treatment of concussion in sport. Treatment of concussion in sport by Dr. Marsh. Yes. So treatment of concussion in sport. Yes. 8 students are there now. Very good. Yeah, you can invite your friends. Yes. This is the first page. So this is the first page. And we have the second page. So 2 pages. So we have 2 pages. So the first page and the second page. So we have 2 pages. I have posted, this is the first page and this is the second page. Okay. So already get ready. Take your notebooks, keep it in front of you. And yeah, we are moving ahead. So here, this is what it is, the introduction. So 31 to 36 questions. You hear an interview with a neurosurgeon. So neurosurgeon, it is related to neurology and surgery. So Dr. Marsh, and is going to talk about the treatment of concussion in sports. So right, let us see these things. Yeah. Um, so these are the three things. Control C. A, B, C. So A, B, and C. So that's fine. This is the question. This is the question. We'll see now how we can increase the strength. There are 9 students. So what we'll do is I will try my best to make it 18 to 20. Now what you do is you can inform at least one student. Okay, because I'm going to show you something different. Something different, totally different. So take time. So question number, okay. So 6 plus 6 plus 12, 12, 24, 12, 3 is 36, 37. So this is 37th question. Not 37th question, actually it is not 37th question exactly, but even more than that. So yeah, page number 100. So this is test 2, I suppose. Yeah, test 2. So 12 fours are 48. So this is 49th question. 49th question. But here the question number is, in this particular test, the question number is 25. 25, no, 31. Yes, 31. Iron Marsh. Okay, 31. Okay, it is 31. Question number 31. Yeah. So question number 31. Question number, yeah. Let it be like that. Okay. There you are. Now read the question and think about it. So, but before that, if possible, you can inform your friends. Let them who are going, let them go. No problem for us. Okay. So we need not bother about everyone. Yeah. So this is the question. Yes. Now I'll give you the audio link and I'll play it for you. Okay. Yeah, here is the audio link. Second test. Okay. It is the audio link. The audio link. The second test. Part C. Extract 1. Yes. So there you are. Pass the screen. So I have passed the screen. And you cannot see what answer I am going to give there. I'm going to feed the answer there. Create poll. Question number 49. Question 049. Okay. Right. Create poll. Quiz mode A, B, and C. Okay. Focus, attention, concentration, techniques, and strategies. Focus, attention, concentration, techniques, strategies. So I'm feeding the answer now. Yes, I have fed the answer, but don't try the answer now. First, we are going to listen. Okay. Listen to the audio. Resume share. Okay. Hide floating. Yes, I'm going to play the audio now. Here is the audio. Test number 2. Yes.
Occupational.
Dr. Marsh. My guest today is Dr. Ian Marsh, a specialist in the treatment of concussion in sport and a co-author on a new set of guidelines. So, Dr. Marsh, what's the aim of these new guidelines?
Well, the aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers and coaches of young people playing sport. The guidelines basically offer some expert information from a GP, an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that.
And how do we know when someone is suffering from concussion?
Well, obviously, if
So what we have to do is, you have to answer. So I'm giving the link. Okay, I am giving the link where you can answer. So here is this is the place where you have to answer A, B or C. Okay, copy, post link. And I'm giving you the post link here. You'll know the answer there. And you'll also know the answer here. Copy message link. First one is the better. Okay. So you can go and check. Two people have given the answers, A, B, C. Two people have given the answer. Okay. So you can check it out. Right. Yeah. You can check it out, A, B or C, which is the right answer. You can check it out. You can click here and you can get the answer here. A, B or C. You can click and you can get the answer there. So one person has answered this question. Okay. One person has answered this question. 5 students have answered. Very good. 5 students have answered it. And now you know what is right answer and what is wrong answer. So now I want you to submit your response here. So wait. Okay, 5, 4, 3, 2, 1, and submit. So Evelyn has submitted C. What about the rest? Okay, Rehana, C. What about the others? What about the others? Okay. Right. So 1, 2, 3, 4 have given the answers. So we are moving forward. Now, yes. Okay. Right. So now, so just bear with me for a few seconds because I'm going to show you something different. Okay. Yes. So what you are going to show is I'm going to show you something I told, and I'm going to show it to you now. This is page number 3. Okay, here it is. So 76, so 100, not 100, still far ahead. Yeah, so here it is. Iron Marsh. Right. Yeah, so that's it. This is a female voice. This is a female voice. Right. Then you have the male voice. I'm going to show you how the twist occurs. Twenty-four. Okay. Yes. Now you see and try to identify something different. Just study the points there. See how the twist is going to change your opinion is very important. Right. Now here it is. Yeah. Dr. Marsh says that one aim of the new guidelines on concussion is, so what is the first aim? One aim. What is one aim? So my guest today is Dr. Marsh, a specialist in the treatment of concussion in sport and co-author on a new set of guidelines. So Dr. Marsh, what's the aim of these new guidelines? Okay. Now, yes. Well, the aim was really to provide a resource, not for the top level professional sports people, but for parents, teachers, and coaches of young people playing sport. So the guidelines basically means provide some expert information. So it is providing expert information. So resource means information. Here he has given and here also he has given. A resource means some expert information. From a GP. An emergency physician, and myself as a neurosurgeon about what the condition is. Okay. And how to identify the symptoms and how to manage it. So try to understand that, what he's telling. Okay. So he's telling how to identify and manage. Identification and managing. Yeah, identification and managing concussion. So that's it. So identifying symptoms and managing concussion. Okay, now you see very clearly. Yes. One aim is. The aim is. Okay. One aim. Fine. So is for what? Is right. To provide a resource, or you can say to offer some expert information. So both are the same. Information why for identifying and managing concussion. So now how do you get? You may get the same words, or you may get different words. To provide a range of specialist advice. Advice from a GP and a neurosurgeon. Advice from a GP, an emergency physician. From a GP, number one, an emergency physician, number two, and myself, a neurosurgeon. So three people together are giving this. So three experts are there. So three experts. Experts means specialists. Experts means specialists. So now you see here, experts. Expert number 1 is a GP. Expert number 2 is a emergency physician. Expert number 3 is a neurosurgeon. So these are the 3 specialists. Experts. Okay. And we are offering some information, means advice about how to identify and how to manage. Advice regarding these 2 things. One is how to identify and how to manage. So these are the 2 things. So you are providing. One aim is to provide. The aim is to provide. Provide what? Expert information by 3 experts. Okay. Specialist advice. So that is what it is here. So this is how you have to identify. Okay. This is what you have to identify. Is this the correct answer? So is this what you have given? Is this the correct answer? Now let us see whether this is the correct answer or not. So yes, this is first one is 1 second. Yeah, 31 is a C. 31 is C. So 31 is C. So try to understand how it is analyzed. So this is the way how you are going to analyze the question. Okay. You should know what is talking about what. Print a screen. Yeah. Oh, sorry. Okay. Next. Now my question is, were the synonyms useful in reaching the answer? So say yes or no. Say yes or no. Just hit yes if it is yes. If it is not, then say no. Because there is no meaning of learning vocabulary if there is no use. Okay. So now, shall we move on to the next question? Okay. So yes or no? Shall we move on to the next question? Yes, I need at least half. Okay. 6 people have said yes. So we'll move to the next question. So this is 32nd question. So this will become automatically 50. Okay. Fine. Yeah. Next. This is 32. Question number 32 is here. That is question number 32. Yes. Okay. Right, 32nd question. The three options are here. Yeah, these are the three options. So there you are. That is second question. What's the 50th question? Okay. Right. Print a screen. Okay. So this question is number 49. 50. Okay. Now I'm going to give you create poll. So this is 50. Quiz mode A, B, and C. This is focus, attention, concentration, techniques, and strategies. So I'm going to fill in one A or B or C, and I'm going to hide the screen. A pass screen. You cannot see which answer I am giving now. Okay. And the answer is yeah. I have given the answer now, but you have to listen before answering. Okay, I'll play the audio for you. So resume. Now I already gave the answer. So I'm going to play the audio for you once again. Yes. So here is the audio. So I'll start from here once.
Person's actually knocked out, it's clear.
Identify when it starts, when it stops, where it is changing. The first question to the second question, how it is shifting, just notice. The voices change, male, female.
My guest today is Dr. Ian Marsh, a specialist in the treatment of concussion in sport and a co-author on a new set of guidelines. So, Dr. Marsh, what's the aim of these new guidelines?
Well, the aim was really to provide a resource, not for the top-level professional sports people, but for parents, teachers and coaches of young people playing sport. The guidelines basically offer some expert information from a GP an emergency physician, and myself as a neurosurgeon about what the condition is, also how to identify the symptoms and how to manage it. If any of your listeners have ever had a concussion doing sports, you'll know how frightening it can be. It's confusing and painful and difficult sometimes for teachers, parents or whoever to work out if someone with concussion is okay. I mean, we hope to remedy that.
Mm-hmm. And how do we know when someone is suffering from concussion?
Well, obviously, if the person's actually knocked out, it's clear. But not all patients actually lose consciousness. Often, following a hard knock to the head, they become disorientated or experience headaches, nausea or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity.
Right.
When they start to train, say. So it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided.
Yes, and you say that waiting anything less than 14 days after all the symptoms have cleared would be too early to return.
Yeah, that's right. If they go back too early, they risk a second concussion. And as we know from professional athletes, they may have to give up their sport if they have too many.
So that is how it is going to be. Now you might have answered the question. Now what you can do is, you can go to the Telegram channel here, copy, post a link. There you can submit your answer. This is question number 50. Question number 50. Or you can go here, copy message link, and you can try here. So you can try your answer there, and you will get, so here A, B, C, you can check and you will know whether the answer is right or wrong. You'll know whether the answer is right or wrong. 3 students have answered. I have given you the link to go there and submit your answer. Yes. So you can submit your answer there. Now, let me check how many. 7 answers are submitted. Okay. Now you can submit here 5, 4, 3, 2, 1. Submit in the chat box. So, Rehana, Evelyn, Reenas, Binu, C. Okay. What about the rest? Fine. Now let us check the answer, whether it is right or wrong. So part C. So first one is 31, that is right. 32 is also C. Have to take precautions to avoid recurring. So that's it. Second one, 32nd one also is C. Okay, that's good. Now, how to identify that this is a C? Now let us take that one. Okay. Fine. Okay. Yeah. So next one is this one. Yes. Okay. So we got this one here. So, very good. Most of you have responded. Now let us see and study the question point here. Female voice and male voice. So you have to identify. Okay. Marsh is a male person. So female will be the question. So you have to identify. That means when a female person is coming inside, that means the topic is changing. And how do we know when someone is suffering from concussion? Means identification. Identification. That you have to notice. Well, obviously, if the person's actually knocked out, it's clear, means becomes unconscious. Knocked out means become unconscious. But not all patients actually lose consciousness. That means some don't get unconscious. So, often following a hard knock to the head, they become disoriented or experience headaches, nausea, or vomiting. These are signs of concussion, and they may clear initially, but then return when the individual actually undertakes further physical activity. Right when they start to train, say, so it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing again until those warning signs have completely subsided. So now he's telling how. Okay. So now he's telling what he's telling, you see there. Okay. So try to understand what he's telling there. How do we know when someone is suffering concussion? Yeah. How do we know? Means how can we identify someone is suffering from concussion? How do you know? Means identification. Okay. So how do we know? And knocked out, that means a person will not be knocked out. That means he has concussion. Finished. Number one, but not all. So that means it's not 100% clear that we can know that he has concussion. So often following a hard knock to the head, they become disoriented. So disorientation. Or experience headaches. Okay. So now here, this is answer to this question. But here, Dr. Marsh makes the point that someone who has suffered a concussion will. So what he has to do? Will he be unconscious for varying amounts of time? No, not all. So this is ruled out. Not all patients will be knocked out. Unconscious. So a person who suffers concussion will not always be unconscious. Some people may not become unconscious. They may just become disoriented or experience headaches. So this is first one. A is ruled out. A is ruled out. Need medical examination before doing any further exercise. Yeah, need medical examination. So here, these are signs of where is the point of physical examination, medical examination. There is nothing called medical examination here. We did not talk about medical examination before doing any further exercise. There is no medical examination. He did not say anything about medical examination. He's just telling about the symptoms, that's all. Okay. So these are the symptoms, how you can identify concussion. Disorientation, nausea, headache, vomiting, these are. So he's not talking about examination. Fine. These are signs of concussion. Yes. So there is no need of physical examination here, according to this particular thing. Okay. So these are signs of concussion. And they may clear initially, but then return when the individual actually undertakes further physical activity. So, right. Therefore, so it can actually take quite a while for things to really clear up. The essence of it is that people shouldn't start playing. So people shouldn't start playing. The essence, the meaning. What is the meaning of this explanation? Essence means important thing is that people shouldn't start playing. So they shouldn't start playing until those warnings have completely subsided. Okay. So have to take precautions to avoid the risk of symptoms recurring. Do you know the meaning of the word recurring? Recurring means reoccurring. Recurring means reoccurring. So happen again. Okay. So here you see. But then return means reoccur. These are signs of concussion and they may clear initially, but then return means reoccur. These signs and symptoms reoccur. So that is what it is. Return means reoccur. The word re is giving an identification here. Re means re. Occur means turn, happen. So they can happen again, reoccur. Return means happen again. They can come back, means happen again. Return, reoccurring. So what do you mean by recurring? So you should know the meaning of the word recurring. Yes. Recurring. What do you mean by recurring? To happen many times or to happen again? It is a C2 word. I don't know whether you can understand what I am telling by C2 word. If you don't know the meaning of recurring, you cannot identify the answer here. Recur means reoccur, means happen again. So that is the meaning. You are tested for this. Have to take precautions to avoid the risk of symptoms recurring. So they recur, they return when the individual actually undertakes further physical activity, right? When they start to train, say. So it actually takes quite a while for things to really clear up. So warning signs, warning means risk. Warning signs you give to avoid the risk. You will give warning signs to avoid the risk. Avoid the risk. So in order to avoid the risk, you give precautions. Precautions are warning signs. Warning. Warning signs means precautions to avoid the risk. Stop there means there is some risk you want to avoid, so you are giving precautions. You are telling stop there. So warning signs. Precautions to avoid the risk. So that's it. Okay. So I hope you understood what I'm telling you. We'll have to take precautions until it totally cleared, because it may return, it may reoccur. Okay, will not. So makes the point that someone who has suffered a concussion will have to take precautions to avoid the risk of symptoms recurring. So once you got concussion, so you may get again, the symptoms may reoccur. So what you have to do, you have to wait until those are totally subsided. Okay. So that is warning signs. Precautions for, you are giving a warning so that you can, that is precaution to avoid the risk. Warning is to avoid the risk. So you should know that. So the word reoccur is recur. Is a very special word. Recur is a very special word. C2. C2 means a very special word. It is advanced level. You have to know this word. It's testing you whether you know this word. Return is easy to understand, but recur is little difficult. Recur means reoccur, happen again, return. So again and again it may happen. That's what he's telling. So you have to take precautions to avoid the risk of recurrence or reoccurring or returning of the symptoms. Take care. He's telling warning signals. That means precautions to avoid the risk. So that is everything there explained. So until then you have to avoid, means you should not start playing. That is avoiding. Okay, so that you will take precautions. Fine. So that is the explanation. That is the explanation. So you have seen the answer. That is C. Have to take precautions to avoid. That is C. Fine. So there you are. I hope you got a clear picture of what is C2 vocabulary. You don't know the answer. You cannot identify the answer because you don't know the word. You don't know the meaning. So that's why C2 is advanced word, and not everyone will know the meaning of recur, recurrence, recurring. Okay, right. So 2 questions. So we have time to take one more question. So one, okay, was the explanation clear enough? Say yes or no. Say yes or no. Say yes or no. Okay. Now next point is, shall we complete another question? Shall we complete another question? So 3 will take, and night if possible we'll take another 3. So I need at least 7 students say yes. 1, 2, 3, 4, 5. So 6, 7. Okay, fine. We got 7 yeses. So 51. So 33. 51 and 33. Okay. Question number 33 is here. Yes, 33, question number 33. And there are three answers here. Three options, sorry, not answers, options. So that is A, B, and C. Yeah. That is the point. So we got, so third question. Here you have this point. So we are going to do the next question. The last for this. Print a screen. Yeah. 33. And what I'll have to do is, I'll have to give this. So 51, Control C, edit 51. Yeah. And the options, create a poll, 51 quiz mode, A, B, and C. Focus, attention, concentration, strategies, techniques and strategies. Okay. So now I'm going to feed the answer. So pass the screen so that you cannot see what answer I am giving there. Yes, I have created, and now resume share. Here it is, and I'm playing the audio.
Concussions.
Right.
So it's better, particularly in a young person with a developing brain, to allow all of the symptoms to settle and only then return to play. Well, usually return to train first, then return to play after that. It used to be thought that receiving another concussion could lead to severe brain swelling, and that could be fatal, or at least involve a visit to the emergency room. I think the evidence is fairly slim for that. What we do know, though, is that the compounding effect of having one concussion followed by another seems to be more severe than just the one. So it's always better to let the brain recover fully before playing again.
Right, so who's at the highest risk of sports concussion?
Well, actually, a concussion can happen whenever anyone receives a blow to the head. Usually it's a sort of twisting blow, not a straight-on blow. But obviously, people playing sports like rugby, where there's bodily contact, stand more chance of being at the receiving end of such a blow. But having said that, it's just as likely to affect kids kicking a ball around a park as it is to affect top professional players in big matches.
Do you think that youth sports need specialist concussion doctors on hand, like the professionals do?
There's always a risk, and we know that.
Yeah. So here you are. I'll give you the link where you can answer. So copy post link and then copy message link. Yes. So now you have got, so you can click on the answer A or B or C. You can click on whichever you want. Okay. Yes. And you will know the answer. So 3 people have submitted. Okay, 7, 6, 5, 4, 3, 2, 1, and submit. Yes. Submit your answer. Let us check what is the answer. Okay. The answer is A. The answer is A. The answer is A. Okay. Yes. So that's quite obvious. Answer is A. Many of you have given B. Many of you have given B, but the answer is A. Okay, now let us see why A is the right answer. That is what I am showing you. Okay, because you people think that answer is right, but we are facing a problem. So that is okay. Okay, right. So Dr. Marsh, subsequent there the brains. Dr. Marsh, subsequent there the brains. Okay. Now, okay, third question is here. Fine. Okay, that's it. So you can see now. Yeah. Yes, and you say that waiting anything less than 14 days after all the symptoms have cleared would be too early to return. Dr. Marsh says returning to sport too early after a concussion is danger because means the reason why. The reason why. Okay. The reason is why. Okay, fine. Let us see here. So you need to know vocabulary, that is very important. Yeah, that's right. If they go back too early, they risk a second concussion. And as we know from professional athletes, they may have to give up their sport if they have too many concussions. Right. So it's better, particularly in a young person with a developing brain, to allow all of the symptoms to settle and only then return to play. Well, usually return to train first, then return to play after that. It used to be thought that receiving another concussion could lead to a severe brain swelling okay, that lead to, it used to be thought that receiving another concussion, another concussion could lead, so result could lead to end up in severe brain swelling, and that could be fatal, or at least involve a visit to the emergency room. So ICU, emergency room. I think the evidence is fairly slim for that. What do we know that is, though, is that the compounding effect. Do you understand what this is? Compounding. Do you know what is compounding? Okay, if you did not understand, at least the next word you can focus. Effect. Effect. So it is talking about the effect. Effect is here. Cumulative means, do you know the meaning of cumulative? You don't know the word of compounding, you know the word, don't know the word cumulative, then how you are going to face this one? That is why every one of you lost this mark. What do you mean by cumulative? What do you mean by compounding? Is that the compounding effect of having one concussion followed by another seems to be more severe than just the one. So a subsequent episode means second one. The subsequent episode means another one, the following. Another concussion. Episode means concussion. Okay, one concussion followed by another. One concussion followed by another. Everywhere the answer is there. Okay, more severe than just the one. See here very clearly. What I am showing you is important. If you see here, effect, cumulative means compounding, subsequent means another. First one is one, subsequent is another one. Episode means concussion. Subsequent episode means another concussion. Have, cumulate, okay, right, have, of having. So all the words I'll show you now one by one. No hurry. Having, have. See there. Yeah. So you can see everything. Why means because. Why means because. Okay. Why means because. Okay. So it's giving the reason. Using condition, if they go back too early, there is a second concussion. Second, here also it is there. So they may have to give up their sport. Here also is their answer. Okay. If they may have too many concussions, particularly in young person. Okay, and then return to play. So here you see, everything is very clear. Now I'm changing the color. Now, yes, and you say that waiting anything less than 40 after all the symptoms would be too early to return. Yes, too early to return because, okay, the reason is, okay, they may have to give up their sport. So why? Because receiving another concussion, subsequent, I'm giving you another point here. Another means subsequent. Episode means concussion. Could lead to means have. Okay. Cumulative effect. Severe brain swelling. Then emergency room, all these things. You can see there. So, cumulative and compounding, two words are dangerous here for you. Okay. There are two words which are very strong. Now let us see the answer once again. So the answer is A, because a subsequent epicode can have a cumulative effect. Can have a cumulative effect. So just check it out. So print the screen. Okay. Right. Now let us see cumulative and compounding. The meanings I am going to show you now. Okay. Cumulative. C-U-M-U-L-A-T-I-V. Cumulative. Cumulative means increasing by one addition after another. Means adding up. Okay, accumulation means additions. Compounding. Okay, now let us see what is compounding. Compounding means a chemical that combines two or more elements. Compounding. Compound, to make a problem or a difficult situation worse. An already difficult situation, it is going to become worse. Compound, to mix two things together. Compound consisting of two or more parts. Compound, a mixture of two or more different parts or elements. To make something worse by increasing or adding to it. Used to describe compound, used to describe a system of calculating interest in which it is. To calculate the interest. Okay, that is compounding means grouped together. Collective. Collective, cumulating means collective. Okay. So because you don't know the meanings of these words, that is why you are facing difficulty. Okay. Now the question is, yeah. Did you understand the importance of meanings, synonyms, and antonyms? So they play a very crucial role. If you understand the importance, say yes and start learning. And start learning. Start learning that. Yes. Now, final question. Do you consider the session beneficial for you? Tell frankly, don't just say like that. Just think about all the things and say, do you think that the session was beneficial? Yes. Okay, if it is wrong, no problem, Dinny. At least you know that it is wrong. So next time you'll be very careful. Yes. Yeah, Dr. Rehana.
Yes,
Yes, Dr. Rehana, was that useful session?
yes, yes.
Can you explain why it was useful in your own words?
Because if I don't know some of the word meaning, so I will lose the question. So I have to have the synonyms of all the words like cumulative. Cumulative, I knew it is increased or forced, but compound, I was not sure. Compounding. So that's why you will lose the question if we don't know the synonym of the
See,
word.
many people, they have lost the question because almost all the students have lost the question because they don't know the meaning. They don't know the meaning. That's why they lost it. Correct?
Yes,
So
correct.
people think that they can do it. I can do, I can do, I can do. No, it's impossible. Impossible without synonyms. It is highly impossible. No question. It's just a lottery system. Then next one. Hello, Punita. Yes, Reena.
Yes, sir.
Yeah, was that useful for you? Why did you think that this is beneficial? Can you explain in your own words?
It's like, for example, like we have to know the meanings exactly, then the synonyms, then only we can find out the answer. So it was really like easy way to find the answers in that way.
Okay. Now, I am going to take another reading, four questions. Okay, in the night, reading 4 questions. Okay, so morning I have taken now. So evening again, I'm going to take reading 4 questions. This is for the night batch. So if you are interested, you can join that also. That is extra for you. And listening another 3 questions. So this is for the night batch. I'm taking another 3 questions for listening and another 4 questions for reading. If you are interested candidates can attend. This is not for the Indian students here in India. This is for the abroad students. So those who are working abroad or staying abroad, so they can attend this session. Okay, right. So fine. After some time, I'm going to take a session for speaking. So anyone interested? Anyone interested for speaking? So a session for speaking, this will be at 7 p.m. Now what is the time? What is the time now? It is 6:10. So 50 minutes. After 50 minutes, 50 minutes. After 50 minutes. So you can join after 50 minutes.